Hey guys, welcome to week 7. This week we'll be working through chapter 53 in its entirety. It's a long chapter compared to what we've been doing week to week, but it is the final chapter and it should go pretty quickly. So chapter 53 is about medication administration. So to start, medication administration is one of the most important and also most dangerous duties for a medical assistant, LPN, or nurse. Depending on what path you're following, you could run into this regardless of your title. You need to keep the patient safe, and you have to keep yourself safe. This includes calculating dosages accurately, measuring drugs accurately, and administering drugs appropriately, knowing as much as possible about the patient. To start with, you'll probably interview your patient. You'll get a list of their drug and drug allergies. You'll take note of the condition, and you may even have to get them to sign a consent form, and as well as document the site of administration. Drugs and drug allergies includes not only the patient's medication list at home, any over-the-counters, vitamins, supplements they might be taking, and a list of their allergies, which may include things they're not actually allergic to, but more, I guess you could say, sensitive to. The administration site is also called the route, and it may include local or systemic, such as by mouth or intravenous effects. Local would be more topical, applied to the skin, or inhaled. For an injection, you must locate and inspect the injection site, and that means making note of anything like moles, scars, birthmarks, redness or rash to the area, burns to the area, tattoos, or anything else unusual about the area. Patient condition includes any reason that the patient might not be able to take the medication, such as if they are nauseous and they might not be able to swallow a pill or keep it down. And the patient consent form, usually you see this more in vaccines or drugs that are not truly approved that are on emergency use authorization, which we've seen in the past few years quite a bit. And otherwise, consent forms aren't always needed. So some general rules for medication administration. Give the drug only as ordered and triple check the medication and the dose that you've calculated. Always double check for patient allergies. You're going to want to wash your hands before you begin, but don't leave your medications unattended. You're going to ask the patient to restate their name and date of birth, and be sure that the physician is in the office just in case the patient has a reaction. You're going to observe the patient for adverse effects and give instructions on what side effects they might expect. And you're also going to discard any unused drugs according to policies. So when we're dealing with patient medications, we want to make sure that we're following the right. And this book has 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I've seen anywhere from usually 6 to 7. They do have a few additional ones. So right patient, right drug, right dose, right route, right time, right documentation, right reason, right to know, right to refuse, and the right technique. So the right to know and the right to refuse, patients should be educated about the medications they're receiving, and they always have the right to say no. The right technique is also an extra one that they included. So sometimes that may come into play, sometimes it may not. So drug routes, there are many, and I would make yourself familiar with them, but it includes all the ones listed by here. Usually we include anything that is enteral, means it passes through the GI system. Everything else is considered parenteral, and that might include intravenous, intramuscular, intradermal, anything that's not going through by swallowing. So let's see. We're going to go through a couple of these. Buccal and sublingual usually means placed in the mouth or under the tongue, although they do not follow through the GI tract. Instead, they are absorbed through the vasculature in the mouth. So they don't go through the stomach or the intestines. And as far as medications by injections are considered, you're going to want to become familiar. Sorry, we kind of skipped through that. I missed the slide on that one. You're going to want to become familiar with needle sizes, as well as syringes and their parts. So needles consist of a hub, a hilt, a shaft, a lumen, point, and a bevel. I don't think we have a picture in here, but I would reference the picture on page 1167 in your text. Syringes can come in multiple sizes too, 1 ml, 3 ml, 5 ml, 10 ml, or bigger. And you want to make sure you have the right size syringe for drawing up the amount of medication you need. And in addition, you'll want to make sure you get familiar with needle lengths and gauges. Longer needles might be harder to draw up medications, and they might be more reasonable to use for, say, an IM injection. And the gauge of the needle, the smaller it is, the bigger the actual needle is. And the larger the gauge number, the smaller the actual needle is. So there are several methods of injection. This includes intradermal, which is just under the skin, subcutaneous, which is within even lower than intradermal, intramuscular, which is within the musculature, and intravenous, which is directly into a vein. As far as other medication routes are concerned, you might have inhalation therapies, topical applications such as ointments or transdermal patches, urethral administrations, vaginal administrations, or rectal administrations. Pediatric patients usually almost always take oral medications or possibly intramuscular medications. It is rare that we set up an IV line on a pediatric patient unless we absolutely have to. As far as pregnant patients, when dealing with pregnant patients, we want to remember that you're actually caring for 2 patients at once, both mom and child. So keep that in mind. We're always going to want to check, is this medication safe for pregnant moms or moms who are breastfeeding? And that's something you can reach out and ask a pharmacist or check within your resources that you have at work to see if the medication is safe. Patient education about medications. As a medical assistant, you play an important role in educating patients, especially if you're administering medications. So you should always give patients information about the drug that you're administering, as well as if they're taking any over-the-counters they might have questions about, you can inform them on that as well. You should inform them about drug-drug interactions or drug-food interactions. There are some medications that you have to keep away from certain foods. And again, if you have any questions, you can always reach out to your pharmacist or your provider. The one I can think of most commonly with food would probably be a drug called Coumadin or warfarin. That has to be kept away from excessive amounts of leafy greens because it can actually make the drug less effective. The book gives the example of Parnate, which is an MAO inhibitor, and you're supposed to keep that away from aged cheeses and meats or other foods containing high levels of tyramine that can produce a toxic effect due to a drug-food interaction. So you should also educate your patients about adverse reactions that could occur when they take the medication you're giving them. We probably want to make sure we have a complete medication list so we can do an interaction check. And we want to explain why it's important that the patient is compliant, how and when they'll take their medication, as well as for how long. Usually compliance means that the medication is going to work to the best of its ability if the patient is being 100% on target with when they're supposed to take their medication and how often they're supposed to take their medications. We always recommend that patients avoid alcohol when they're taking medications because alcohol can interfere with absorption and metabolism of a medication. And we want to make sure they're feeling their best and not their worst, really. So as far as charting medications, this is a very important part of medication administration. We want to make sure we have the correct patient chart and the correct location of the chart. And we want to make sure we have the accurate physician order within that chart. And we're going to be as specific as possible, remembering all those rights we discussed earlier. You don't want to leave gaps because someone may need to come behind you and verify that you actually gave the medication and when you gave it. And you're not going to want to erase any errors. Instead, you're going to want to draw a line through the mistake and document below that. Try to avoid using ditto marks or drawing arrows down if you're writing the same thing. Always going to write neatly or use spell checker if you're on a computer. And use the correct abbreviations or approved abbreviations and symbols. And if you are ever unsure, go ahead and check with a provider. So that pretty much summarizes this chapter. Again, it moves quickly because some of this should be familiar. There's no difficult math concepts, no history here. Really, we're just talking about the sheer process of administering drugs. I would recommend working your way through the procedures at the end of the book on page 1176 all the way through 1187. That takes up the bulk of the end of the chapter and is kind of just a repeat overview of how to administer drugs. This week, by the end of week 7, you want to make sure you have your drug information project turned in. Week 7 homework on Connect. The Smart Book assignment will help you get extra credit on your test. And of course, you'll be completing the Chapter 53 test. As always, and I'm sorry, I don't think there's a forum this week. Yes, there is. Never mind. Sorry, it's week 8 that there's not a forum. Although I may extend it out to week 8 depending on how everyone's doing. Keep an eye out on the announcements for office hours and information on the final for week 8. Hope you guys have a great week, and I'll talk to you soon.